Okay, and after they suppose some people after the age of 20 they are taking alcohol. Some people are not sure whether am I taking alcohol within the acceptable limits for the health or am I taking it too much. So the moment you have that doubt, actually there are measures to check. There are some simple questionnaires. There are professional helps available to see are you going into the grey zones of addiction? Are you going to the zones where alcohol consumption is going to be affecting, damaging your liver and brain and other vital organs? So there are professional help available to actually see whether are you crossing these Lakshman rekhas of addiction as well as the toxicity to vital organs. Similarly, vision, everybody after the age of 65 years, I don't have to say, vision and hearing invariably gets affected. So things like cataract, you can do a lot about it. Hearing aids are available and they can certainly make life a lot more better actually. And sometimes if you have a retinal tear, which happened unfortunately to my own father actually, we thought there is a cataract, but actually a retinal tear was developing behind his lens, which because of the cataract, and the cataract was not ripe enough to be operated. That tear actually went on to develop a detachment because the fluid goes through the tear behind the retina and pushes the retina forwards. So after the age of 65, be sure that if you are going to an ophthalmologist, go to a good ophthalmologist. Somebody who doesn't look only at the cataract, who has got equipment to see behind the cataract and make sure that your retina is also healthy. They are not developing holes or tears which can make them prone to have retinal detachment, which can actually make you lose the vision irreversibly. Okay, cataract you can do, but retinal detachment you cannot do anything. Now, suppose these are the actual impact of some of the very important preventive measures on health. If by controlling usage of tobacco, actually the overall health risk is reduced by as much as 20%. This is one way of actually presenting the information, which may be a little difficult to understand, but you can at least make some comparison. Suppose you drive motor vehicles by taking alcohol or without using seat belt. Your chance of using a life or a population chance of losing a life, if everybody uses seat belts and takes alcohol, improves only by 1%. But if everybody after the age of 35 stops smoking, the improvement in health or improvement in longevity is by 20%. See how much damage tobacco is doing to each individual and the society. Similarly, diet and physical activity, very close to tobacco, 15%. If you are able to control your diet, if you are able to do regular, basic, minimal physical exercises, that itself actually reduces the risk to the health by as much as 15%. And see, if you compare with promiscuous sexual habits or taking toxic drugs, etc., see, they are only 3% or 1%. Whereas simply by controlling your diet and your regular physical activity, you are reducing the health risk by as much as 15%. So the importance of tobacco control, importance of proper dieting, physical activity, etc., can never be overemphasized. Now this is cumulative. This is another way of expressing. If you take all the women, at least 10% of them develop breast cancer. So if you don't develop breast cancer, you are one of the lucky 90%. Similarly, colonic cancers. If you don't develop it, we are in the lucky 94% because 6 out of 100 of human beings develop colonic cancer. Similarly, the other cancers also. Domestic violence, if you are not getting beaten up by your husband, you belong to that lucky 85%, because 15 out of 100 women do get beaten up and suffer badly at home. And hip fractures for women, especially after the age of 60-65, is actually as high as 16%. So these are all very important health hazards, and there are very important 100% preventive measures to health by intervention in all these areas. I think we have covered all these points. one of the things I wanted to actually show here is the use of aspirin to prevent cardiovascular disease. It's a good idea to take if you don't have a peptic ulcer after the age of 65 and 70 years. It's a good idea for all of us to simply take 75 milligrams of aspirin. People in Europe and people in US routinely do this. After the age of 65, 70 years, 75 milligrams of aspirin. You take it with food, take a little bit of food, lunch, take the aspirin and complete your food. This keeps the blood thin and prevents clotting in your major blood vessels going to the brain, going to your heart. So that is something quite important. So those points which I have already discussed, I am not repeating. Now I will go to this third point: training treadmill for healthy man. 8 days, it increases the life expectancy for a whole population by about 8 days if everybody does. That's what it's saying. But in an individual's case, it's very, very important. See, all of us get once in a while chest pain, especially when it happens after the age of 40 years or 50 years. We are all quite worried. But simply you go and do an ECG normal, that doesn't mean that you don't have a ischemic heart disease. Your coronary vessels are not narrowed. But if you do a treadmill test appropriately, that is you walk on a stationary moving tape, and then they measure your ECG activity. If that is negative, your chance of having a heart disease comes down by 95% actually. So if a negative treadmill can almost always exclude a heart disease, and nothing short of that actually can tell you that you don't have a ischemic heart disease. So if you do worry, or even if you want to have a routine checkup for your heart, let it be done as at least a basic treadmill ECG. That is a minimum, not just a simple ECG or not just simply checking your cholesterol. Similarly, after the age of 50 years, if you develop urinary obstruction, etc., yes, simple blood test called prostate specific antigen can be done, which costs around 750 rupees, which can point towards the prostatic cancer. It is a very fatal cancer, but can be 100% prevented if you do it on time, if you detect it early enough. Now, coming to the, suppose if every 35-year-old man, 35 or more old, if he stops smoking in a community, the whole community's life expectancy goes up by 3 to 5 years. Again, you can see how important it is to cut short tobacco. And the other important thing is, from the age of 40 years onward, if each of us start walking at least for 30 minutes, 3 times a week, that much is enough. At least 30 minutes of walk per day for at least 3 days. If everyone is doing this, the entire life expectancy of the whole community or that particular population goes up by at least 1 year. So that's the, so at an individual level, it actually makes far more difference. Right. It's important to actually keep the weight under control. And when we say weight, the body mass index is what is important. The weight is always proportional to the height actually. Those who are short cannot have as much weight as a taller man can afford to have. 20% above body mass index, that is kilogram per square mass. There are nomograms. With 20% above, you are having excess weight. And then you have to actively do something to intervene that. Excess weight produces heart attacks, brain attacks, diabetes, hypertension, all sort of diseases, including in fact cancer. That's not in the slide. If you reduce your cholesterol by 1%, your risk of having heart attack or brain attacks is reduced by 2 to 3% for each 1% reduction in the cholesterol level. So you know how important it is.